So, as we reflect back on this month for being Black History Month and talking about the extraordinary strides we've made in this country, but setbacks we've made in this country, I do want to, before we get started, say thank you to Dr. Lombardi for his friendship, for his partnership. Dr. Guest, same thing. Thank you for what you've done in the community about advocating and awareness and screening. It's important, Deanne Lewis. It's important to have people here to really reflect, the good, the bad, and the difference. And I said one time I was at a church and it was the celebration of Dr. Martin Luther King, who I always like to quote. And I kind of took my speech to the side, put it aside, and I said, if he was sitting here today in this audience, would he say we've gone far enough, or do we go back? And sometimes in this great country of ours with 330 million Americans, we have a tendency to forget about the past, and we want to bury it, and we don't want to talk about it. We want to act like it didn't happen. But the only way you change people's opinions and mindsets is to talk about stuff that was wronged to certain populations or people of color, black and brown, people who are discriminated against, whether they're Italian or Irish or Jewish or Polish, is to really discuss that part of our history and to move forward. That's the only way you're going to change going forward, and you can't forget. So I'm excited to be sitting here today with two extraordinary people in the community that have made a difference, but we also take time to reflect on what's been done well in this country and what we can do better moving forward. This year's national theme is Black Health Wellness, and we wanted to focus on the topic of health equity, which has been the cornerstone of my administration for the last 10 years. And the one thing I can take away from the last 24 months is the effect this has had on the black and brown community and how we really just, we have a tendency, I won't say in politics, but probably everywhere else, you focus on what's in front of you. And then when the emergency's over, we tend not to do an AAR. We tend not to, we'll say, oh, here's what was good, here's what was bad, and we move on, we get back to life. We have to learn from what we've learned for the last 24 months and continue to apply in neighborhoods that we can make a difference in people's lives. So stay tuned for State of My County, because part of it's going to be talking about health equities going forward in certain communities and really focusing on how we can continue the trend and the focus that we've had on this going forward. And that's why I love this partnership we have with MVP, and you're going to see extraordinary things coming down the road, but it's not why we're here. We want to make sure health care is extremely important to everyone in the community, and everyone has access to it and has the opportunity to make sure they get pre-screenings, make sure they can get physicals, but also know the importance of how certain things affect certain communities. But that's why I've worked hard on my equity agenda and to ensure that our minority communities have access to important health issues. We brought the COVID-19 testing into minority communities when this first started, when it wasn't done anywhere else in the state of New York. I took great pride in that, but it was hard and it was a partnership. And I always get criticized when people say partnerships, but it's been a great partnership with you. It's going to be a great partnership with you moving forward, because you can't do it alone. And I don't care who you are, anyone that stands there and says, I, run from them. Because it takes everyone working together. You're only as good as your weakest link, and you're only as good as everyone in your office that surrounds you. So again, it's a reflection on you. The partnership with the rollout with Mohawk Ambulance, getting into the minority community, getting to homebound people. That's what makes a difference in a community, how we can go back and forth and make sure we fairly get out there. Because again, we noticed early on when with the internet, people trying to, the Hunger Games of people trying to get the COVID-19 vaccine, how hard that was for seniors to navigate it. And we worked with variety of different organizations to make sure we had that where you could send an email, line up, and we got you in there. That was Juliet and her team. Thank you so much. But again, working together, we can solve anything. But as we focus on Black History Month and we focus on the stuff that has been on, obviously has changed on a national level, and the movements of different organizations and the inspirational of stories of families, the resilience of bouncing back and trying to make a difference in the memory of their loved one, has really changed. And I really seen it this last year how things have really changed. In the past, you get a movement, it moves on after a couple months. And this has really made a difference, and that's why I think it's great to have two great partners to talk about the pandemic, the virus, that it has had on people, the inequity it's had on people in the community. So Dr. Lombardi runs Central Med. That's where we met him, and he opened up a little over two years ago, which I thought you there, right?
Yeah, there, but just a little less, August
A
2020.
little less in extraordinary in COVID-19 world. And I'm like, he is not going to make it. And boy, did I not know about his resilience and what he's really done to the community. But he's done a lot for us. Dr. Lombardi also took part in our video series last year called Just the Questions on COVID-19, where we had doctors in Albany County stopping the myths about the virus when people are putting false information out there. And I always had to tell everyone, when you're on Facebook or any social media site you don't have to prove your work, you can put any statement out there. Don't believe everything you read. And the PS commercials you've done for us, coming here when I was doing COVID briefings, talking to the community, and especially everything you've done at your Central Med on Central Avenue, doing the COVID testing for kids, keeping kids in school, helping parents. And I know that was difficult. I know the lines were out the door. But again, you always handled it well. So thank you so much for being here. And also Dr. Guest. Thank you so much for being here. And she's with, I hope I say this right. I do always get criticized for the way I speak sometimes. So hopefully it works today. My tongue's not twisted. But Braverman Panza Internal Medicine Group, focused on family medicine. You work for St. Peter's Healthcare Partners, who's also been a great partner. St. Peter's Hospital, Dr. Reedy, the whole staff there through this whole thing. I can't thank St. Peter's for their partnerships. But what you've done, your important role in promoting not just wellness and health, but pre-screening. And, I was amazed at how many friends I had, or have, I shouldn't say had, well, they probably left me after COVID for 24 months, but that never got pre-screened. Never been to a doctor. It's like, I don't want to call him out, a good friend of mine, and 40 years, never went to a doctor and had to get a triple bypass or 5 bypass, but never went and ever had a physical in 40 years and took pride in it. I'm like, what are you, crazy? We got the best medicine in the world, and pre-screening can prevent a lot of stuff that happens to you. And I like your advocacy that you continue to do in the community for women, especially for women, to get out there and get pre-screened. So this is such a great opportunity for us to ask some questions, for the media to ask some questions. But I don't know, Dr. Lombardi, if you want to say a few words before we get started into the questions and answers, or?
I just want to say thank you for having me here, and I think, and it's been a two-way street. Partnership is always something that I hold dearly, and partnership is something that each and every one of us should hold dearly. Because again, a tree, they say, does not make a forest. So we need each other, and so I think the partnership we have with the county has been good, and it's also been, helpful in a way. Also, in terms of us trying to do our own vaccination clinic through the COVID, and to sort of climb it down the COVID myth and whatnot. So I think it's been good. I mean, he's been tough. He's been difficult at times, but we take pride in what we do. At least, if you say one life, it was worth. There's another life that did not go to the grave. So I think we're very appreciative of that.
Thank you. Dr. Gass, would you like to say something before we get started?
Yes, thank you for having me here. And just to echo the same sentiments, Mr. McCoy. So, just in our St. Peter's practices, we've definitely seen where the screenings have fallen off. So we've seen where, patients have not been coming out for their checks for diabetes, for heart disease screening, for the mammograms, the colonoscopies, and that definitely affects our population. We know that the Black community has had a high incidence of these medical problems. And so just with the pandemic, that's definitely had an impact as far as not being in the forefront as far as screenings. So we definitely have worked together with just letting patients know the offices are safe, COVID, yes, it exists, but we can still work with, making sure that you're safe and just about getting your screenings done. We definitely have programs in place to meet the needs, because we know that insurance is always an issue for patients, but there are screenings that are available. There are free programs for patients who happen to be uninsured or underinsured. We've worked with the community, we've worked with organizations like Albany Med, Whitney Young, just to promote different screenings. We have the fall free mammogram days. We've had prostate cancer screening, cervical cancer screening as well. Of course, some of these programs have been in the back burner because of COVID and having to maintain social distancing, but the programs are in place. And it's just a matter of really talking to our patients and really getting to know what barriers there may be, because not everything is financial. Sometimes it's an educational issue, sometimes it's transportational. So we really need to work with our patients, having that dialogue so they can trust us, and we can identify the needs and work with our care managers and social workers to really get the word across that the screenings are there. So we're all in this together, and we have to make sure that health is of utmost importance.
Thank you to you, and I really appreciate you taking the time, and especially on Monday morning, to be down here to really discuss some some of the health inequities that are going on. But it's been your experience or observation about health equity and the evolution of where we are today, and what has happened in the past, how we've changed so much, and I just really want to know your opinion about how we evolved the last 24 months. And one of the things I'll lead off with too is that I happen to be president of County Executives of America, and we're doing a national lawsuit on insulin. And it's kind of what you just said about insurance, but what people are being charged for insulin, and what we have noticed on a national level, how this really affects the black community with the diabetes and the amount of money insurances are paying for. And I know Congress said they're going to fix it, and I haven't seen anything in the bill, but it's outrageous that they focused on one community and they charge so much for the insulin that will be a game changer. But with the COVID-19, and I don't know who wants to go first. I'm going to go with the doctor over here.
Well, I think,
Go ahead, Doctor.
Go ahead.
I think, again, that's a good statement, a correct statement. But then I think for us to really tackle that, I think we have to come back from a point of understanding, place of understanding. First of all, what is health? Okay. And I think, according to the World Health Organization, health is a state of physical, mental, and social well-being, not necessarily without the absence of a disease. Now, you bring that in, talk about health equity. What is health equity? We're not talking about health equality. We're talking about health equity. So what's the equity? So the equity is the process, is the phenomenon whereby any individual, regardless of sex, race, sexual orientation, disability, are able to fulfill and achieve, they have a just and fair means to achieve their highest health potential. They're not saying equalize the health. No. We need equity. So when it comes to that, as a nation, I think that's where we've really fall short. And I think we fall short of that, and when the COVID hit, we really find out how far behind we are as a nation. With the COVID, who suffered that the most? The BIPOC community. The worst hit. Why? Because of the health inequity we have in this country. And when you talk about globally, how do we even achieve that? What does that even mean? So when we talk about health, a lot of times, probably, to a layman, it's just the patients and the doctors. No, that's a component of it. We're talking about hospitals. We're talking about clinics. We're talking about research centers. We're even talking about nursing homes. And when we put all those compacts together, and then we look at the location where we have all these various entities, and then you look at the communities who are benefiting from all these entities, and you look at the communities that are not benefiting from all these entities. This is where the inequity comes to play. So now when you go back and say, okay, well, part of the components, we're talking about the patients, and we're talking about the doctors, according to Harvard Business Review, 30% of the populations are black, 4% of the population are doctors, and less than 7% of medical students are black. Now you tell me, in a country of 330 or more million people, how do we achieve that equity? How do we achieve that fairness so that those that are really disadvantaged can achieve equity? Equity is, okay, well, if you're able to buy insulin for $2, I want to be able to buy the insulin for $2 in my community. Because this other community, they sell it for $2, but in my community, they sell insulin for $10. It's not fair to me. So how am I supposed to do that? So that's what we're talking about. And I know, I've had this talk before, and trust me, I can talk about this all day, and then I'm not the only person here, okay? But what I'm trying to say, in essence, is that, for us to even be able to achieve the health equity, we have to go back and look at the concepts. We have to go back and look at the components. We have to go back from the beginning and work our way up from. That's the only way. We have to go back to these communities. Okay, what do they lack? We have to go back to the communities. Okay, they have the pharmacy, they have this, they have that. So what are the prices of the drugs in there? We have to be able to go back to the community. The same community, you have Walmart and you have CVS. You go there, the prices are different. Mm-hmm. So we have to talk about all of that before we're able to achieve the health equity. And the evolution, yes, of course, there have been some things done, in terms of, trying to increase the number of, minority population in med schools. I mean, there are some programs that try to identify, minorities from high school and colleges and say, okay, well, this is the route or the path, to med school. If you can achieve this and can achieve this. Now, there are some STEMS research programs, some program for minorities, but it's not enough. It's not enough. So if we are going to address, the inequity in our minority population, if we're going to address the access, to care in our minority population, we have to address the other things that the foundation of why we have this inequity in the first place.
Mm-hmm. And just to continue with that, inequity, of course, has continued to be a problem in our community, but I think education is pretty big. We have to make sure that patients are aware of, what programs are available. Yes, there's price gouging, with different pharmacies and, different groups charging for insulin and, other medications. But it's a matter of really talking to our patients and finding out what the needs are. Because sometimes, as I said, it's not just a financial issue or educational issue or a transportational issue. It's really talking to the patients and knowing what stands in their way. So at St. Peter's, we've definitely had the prescription plans available. We've definitely been able to help our patients with prescription. So if they have issues paying for their labs to be done, if they have issues paying for medications and even, paying for imaging and so on. It's just a matter of really reaching out to them and letting them know that there are programs in place for them to get the medications that are so needed for them. So it's really just a dialogue with patients and really knowing what their needs are. I think we have a really good program with our care managers, with our social workers. If we identify the need, then we're able to just quickly send a task and just get them on board. They're very responsive. So again, it's really just that dialogue with the patients. The patients have to trust us. They have to really be able to let us know what their needs are in order for us to meet their needs.
Just along the same line, they're able to help these patients because this patient came to the hospital or they came to the clinic. Most times, these folks, they come to the clinic when they exhausted all options, and when they're almost at the point of death, which is why we saw a higher numbers of death, within the BIPOC community. Why? Because they just wait till the last minute. Why do they wait? So those are the things we have to address. You cannot really tell a single mom of 3 kids, say, hey, don't go to work today. Go to the doctor's office. Go get blood pressure checked. And she's going to tell you, well, first of all, who's going to take care of my kids? Child care. Secondly, if I go, how am I going to pay my rent? Thirdly, if they prescribe me medication, how am I going to be able to afford all of those? So, from what, Dr. Guest said, these are all right, but we have to be able to get to those patients who cannot come to us at the hospital or who cannot come to the clinic. And the challenge is, how do we do that? How? Because we can't sit here and, say everything we have to say. But the fundamental issue with the equity is just access, and with the access part of it, there's just a lot of different economies. People think about things you and I would not think about. When I have a headache, okay, yeah, I'm a doctor. I know. Oh crap, let me call my PCP or whatnot. If they have a headache, what do you think they're gonna do? Go run to the corner store and get a Tylenol, and pop some Tylenol. They feel better a little bit, and then they leave. So the information, the how to get to them. When they get to us, we'll give them the information. But if they can't get to us, how do we get to them? And to me, I think that's just one of the most fundamental part of this health equity.
And I think that the pandemic has definitely revolutionized how we can access our patients and how they can access us. I mean, we've seen where we've done televisits from almost day one of the pandemic. And I think even in my practice, in my experience, some patients who are not normally compliant with coming into the office, we've definitely been able to get them on the phone. Even if we're not able to do a televideo, then we're able to do a phone call and just, address some of the needs that they may have. Of course, nothing beats the patient coming in, putting a stethoscope on their chest and listening and getting their blood pressures done. But some patients have lagged behind on their labs, they're on medications. What are their renal functions? What do the kidney functions look like? Their liver functions and all. So that has helped us a lot in just really reaching out to the patients and just getting on the phone with them, trying to identify their needs. And I think that's definitely helped. We've had the COVID clinics for those who are not able to navigate going on the internet. Some patients don't have access to a computer, but what we've been able to do is just get that televisit done. We order the COVID tests, and then we're able to send them to one of our outpatient sites to get tested. And I think that's really helped a lot of patients with that. Even the monoclonal antibody clinics, I think that's something that we've been very proud of. If not, we're one of the first, if not the first, in this Capital District area to really have that available for those patients who really are in need with comorbidities. just to help them through the pandemic, through the COVID illness, to really get through the symptoms as quickly as possible and to avoid hospitalization. So televisits have been huge, and I think we'll continue to have those in place to meet the needs of the patients.
Thank you for them answers. So we also want to know, with COVID-19 shed a light on disparities, there's been much attention or work brought by the remedy that it came from out of COVID-19. Can you share with us how involved in this, or the efforts, how the efforts you made to change the beginning of COVID 24 months ago to today?
Okay. Well,
Let's go.
like Dr. Guest said earlier, with COVID, I think everybody, we had to improvise. There were patients who didn't want to come to the office, and even if they come to the office, they're so apprehensive about getting sick. And what we did as a practice, we actually did a lot of televisits. As well. And then some of our testing, we did it in the car for those who were really apprehensive about coming in. And then when the vaccination rolled out, we did numerous vaccination clinics. We did an outreach. We reached out to to our communities and tell them, hey, listen, we understand there's a lot of information out there. There's a lot of myth out there. There's a lot of just too much noise about the vaccines. And as a person of color, I've had my vaccine. I'm good. I did not die. I did not grow horns or tails or whatever. It's safe. You guys can come in. So I think we're able to have quite a good response. We did that on different occasions. That was good. And then also not just for the the black community. We had a lot of the Asians. We have a lot of even some of the Caucasian folks who were really apprehensive about it. They all came, and we got this done. And when the booster dose came around, they started calling the clinic. When is my booster ready? When is my booster ready? So I think we got into them just using an outreach program, just using, sort of at times when you want folks to do something, at times it's always good to try it yourself first. And then you put yourself in your shoes and say, okay, well, I want you to do this, I want you to do that. But you know what? Let me do it first. And then I think that's one thing you've been able to do as a leader. You've always kind of just put yourself out there, put yourself up front. Which is how we even got to know each other. So and I think that's good. As a leader, you think of the need of the community or the need of your folks. If you try to send somebody out there, you got to do it yourself. So that was how I was able to sell some of those outreaches. To say, listen, I've done it. I've taken it. I'm good. I'm fine. Why don't you come? I'll do it myself, and I have to give some of those shots myself. Actually, So, and those were some of the things we were able to do. But then again, and I'll still repeat this. We were able to achieve that because most of those folks came to us first at the beginning. Then we were able to reach out back to them. Okay, so how about the folks that were not able to come to us? And this all circle back, to the equity. I know there was a lot of ad. I think we did a lot of stuff with the county too. Try to get the information out there. Get your vaccines. Those outreaches. So I think if anything at all, these are the things that helped. And I'm just a little bit passive or scared to the fact that when this is all done, then what? Where do we go from here when this is all done? Are we gonna, all the progress we've made within the community? I know the county has a lot of the programs, lots of things that we try to do to reach out to the community. So I just hope that when the COVID is over, we continue our effort. Or I think that when the COVID is over, it's time to double our efforts because we can see the devastation this this can cause. Because we don't know when is the next pandemic or whatever, if at all, but hopefully at that time we will not be reactive, we'll be proactive.
And just to continue with what Dr. Liberty has said, in our community, there's definitely been vaccine hesitancy, and that comes from just the country's past with different dynamics and how minorities have been treated. And a lot of patients, I've heard it all the time. Oh, the COVID vaccine is really targeting Black patients, minorities, but we know that's not true. It's not some kind of social experiment. Patients of all races, all backgrounds have had the COVID vaccine. So it's a matter of education, really driving home the point that patients should really trust the science. The vaccines have been around, and we've seen where they do help to reduce the severity of illness. And we've seen where the patients who have been vaccinated, even with the surge of Omicron recently in January, most patients had mild symptoms, sinus infections, maybe sick for 1-2 days or so. But the patients who were hospitalized, many of them were not vaccinated. So again, driving home the point that we really have to stay ahead of healthcare screenings. You have to come out to see your doctor. It makes sense. You're only one person. There's only one you. You owe it to yourself and to your family to be healthy.
Both great answers, and a lot of stuff still out there to do in the community. And so we talked about moving forward, and I love what the both of you said. It's please, as we celebrate Black history and the inequity in healthcare, it's so important to educate yourself, and that's one of the things when I'm in public and I get hit with that question all the time: should I get the vaccine? Talk to your doctors. That's what they're there for. Talk to your doctor, especially parents with small children. I'm like, you have to talk to your pediatrician. They know you. Go get a health checkup. They know whether or not it's good, how it's going to affect you moving forward. So please go see the experts. And one thing that we continue to grow off of this is the media, the newspapers, the stories, and really just all the health data we all put together, and the inequities. And you said it both perfectly, doctors, that we need to continue to look forward and continue after the COVID-19. I know everyone's tired, but to really how this has affected the Black and brown community, to continue changing that. And the only way we're going to do that is by being advocates, by talking to one another, by educating yourself. You have to educate yourself. And like you said, I know some things, terrible things were done in the past, but moving forward, this is something that's going to save your life. This is something that's going to continue to get us out of this COVID-19. And I was saying earlier to the two doctors, I saw last night, I was reading, CNN did a poll. 79% of the people are done with COVID-19, and I say to people all the time, I know we want to move on. We want to move on and act like it never happened or it's gone. It's not gone. Unfortunately, we had another resident pass away in Albany County, so my condolences and prayers go to that family. It continues to affect us, and it's gonna take a while to get out of this. Be patient. It's been a long 24 months, but we have to stay focused moving forward in the Black and brown community with the health inequities. And I want to say thank you, the two of you, for your time. I could keep you here for hours talking about a variety of things, but I know you're both very busy, but I don't know if you want to say something in closing, Dr. Lombardi?
Well, thank you for having me here once again. Thank you to Dr. Guest as well, and everybody here today. I think regardless of who we are, regardless of where we came from, regardless of what we're doing, I think the most significant element of any human living at all is your health. And so I think we are not talking about this because we want to look cute on TV. I want to look, we're talking about this because this is very important. I mean, look at what COVID-19 has done. Look at how many people died. So I think it's very important. Doesn't matter, Black, brown, white, doesn't matter. Your health is important. do your screenings, see your doctors, listen to your doctors. And most importantly, if you have folks who haven't taken their vaccine, please encourage them to do so. We are almost at the end of the road with this COVID. We're not there yet, so we cannot, let our guards down, but we're coming close. We don't want the work we've put in over the past 24 months to just to wipe out, because of our, disdain for, just patient. So I think this is very important.
Yes, so thank you for having me here. This was very informative and a great way to share with our community of why we do what we do in general. But I just want to drive home the point of staying on top of screenings. I had a patient last week who, after much effort, she finally decided to get scheduled for her colonoscopy. And she does have symptoms, and they're very concerning. But it's just a matter of, really putting forth that effort to, try to see what the barriers are. If it's a transportational issue, if it's financial, we really need to talk to our patients and really see what holds them back in getting those screenings done. And she said something important. She said that for the first time in a long time, in years, she's putting her health first. And she really thanked me for that. And I really hope the colonoscopy does go well, and it's really a good outcome. But again, it's so important to stay on top of your screenings. Again, it's only one you owe it to yourself and to your family.